In this video, we're going to talk about what to do when you have an episode of AFib. When should you call your doctor? When should you stay home? And when should you call 911? It can be frightening to have an episode of AFib, and as a cardiologist, I've dealt with this question hundreds of times. I understand that you don't want to take an unnecessary chance and stay home, but it's also frustrating to go to the ER and be sent home like it's no big deal. Here is what I tell my patients about what to do during an episode of AFib. I do need to emphasize that this is for information purposes only and is not medical advice. Medical advice can only come from your doctor or another healthcare professional with which you have established a relationship. For your safety, realize there is no way that I can know what you should do without knowing you as a patient. Here are some tips if you have an episode of AFib. Number one, if you don't feel well, call 911. If you don't feel well for any reason, but particularly if you have shortness of breath, chest pain or pressure, lightheadedness, passing out, unusual sweating or nausea, or signs and symptoms of a stroke, call 911 right away. Number two, if you feel fine but your heart rate is fast, for example, over 130 beats per minute, you should call your doctor or go to the closest emergency room. Calling 911 is always the safest options, but if you choose not to call 911, do not drive yourself. Have someone drive you. Number three, if you are not on a blood thinner medication and don't have a Watchman device, call your doctor or go to the emergency room. This is particularly true if you don't have symptoms and aren't sure when you went into AFib. More than 24 or maybe 48 hours of AFib when you are not on a blood thinner may increase your risk for stroke. Number four, if you feel fine and your heart rate is not too fast and you're on a blood thinner medication, it may be reasonable to wait 24 hours to see if you convert back into regular or sinus rhythm. I would still recommend to call your doctor and let them know and seek their advice. Number five, if you have any doubts, call 911. Always err on the side of caution. Feeling like you wasted your time going to the ER is always better than staying home when you should have sought urgent medical attention. Having an episode of AFib can be frightening. Although most episodes of AFib are not life-threatening, some episodes can be. Ask your doctor about what you should do if you have an episode of AFib. This information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor. Thanks for watching, and if you want to learn more about living a long, healthy life you love, click the link below to learn more about how we help people increase their health span. And if you like this video, hit the like button below, share it with your friends, and be sure to hit the bell and subscribe.